Okay, bismillahirrahmanirrahim. Assalamualaikum, selamat petang. Pada petang ni, we are going to continue our presentation with our next candidate, Mr. Muhammad Misbahuddin Zahid. Without further ado, I would like to invite Mr. Muhammad Misbah, and together with me is Puan Mazlina and also Puan Azlina Karim as the examiner of this particular exercise. Okay, please welcome Mr. Misbah. Silakan Tuan untuk present.
Okay, Assalamualaikum. Selamat petang kepada Puan Masdila, Puan Azlina dan Cik Aizat. Saya Muhammad Misbahuddin. Ini saya buat tajuk HYDROXYUREA untuk safety data sheet. Lepas tu ada first identification of the substance product identifier HYDROXYUREA. Lepas tu use the substance of mixture and use advice again. Lepas tu hazard identification, classification of the substance of mixture GHS, classification in accordance in 29 CFR 190 OSHA, germ cell mutagenicity, reproductive toxicity. Lepas tu ni pictogram dia, signal word of danger. Lepas tu hazard statement dia, may cause genetic defect, suspect of damaging fertility or the unborn child. Lepas tu ni composition ubat HYDROXYUREA. Lepas tu ni untuk first aid measure, general advice, consult a physician. Lepas tu show the SDS to the doctor in attendance, move out of dangerous area if inhale, move person into fresh air if not breathing, give artificial respiration, and then consult a physician. Next, in case of skin contact, wash up with soap and plenty of water, then consult with physician. Next, in case of eye contact, flush eye with water as a precaution. Is swallow, never give anything by mouth to an unconscious person. Rinse mouth with water, and then consult dengan physician. To firefighting measure, use first extinguishing media, suitable extinguishing media. Use water spray, alcohol resistant foam, dry chemical or carbon dioxide. Special hazard arising from the substance of mixture, carbon dioxide and nitrogen oxide. Advice for firefighter, wear self-contained breathing apparatus for firefighting if necessary. For the invention, no data. Next, accidental release measure, personal precaution, protective equipment and emergency procedure, use PPE equipment, avoid dust formation, avoid breathing weapon, mist or gas. Ensure and adequate ventilation, evacuate personnel to safe area. So, environment precaution, prevent further leakage or spillage if safe to do so. Do not let product enter drain. Next, method and material for containment and cleaning up. Pick up and arrange disposable without creating dust. Sweep up and shower. Keep in suitable closed container for disposable. Store handling and storage. Precaution for safe handling. Avoid contact with skin and eye. Avoid formation of dust and aerosol. Next, condition for safe storage, including any incompatibility. Keep container tightly closed in a dry and well-ventilated place. Common storage temperature 2 to 8 degrees Celsius. Moisture sensitive, keep in a dry place. Storage class TRGS 510, compatible acute toxic compound or compound which causing chronic effect. To exposure control or personal protection, control parameter dia, component with workplace control parameter contain no substance with occupational exposure limit value. To exposure control, appropriate engineering control handled in accordance with good industry hygiene and safety practice. Wash hand before break and the end work day. Tu PPE dia untuk eye dengan face protection, safety glass with the side sheet conforming to EN 166. To skin protection, handle with glove. To net full contact material nitrate rubber. Minimum layer dia 0.11 mm. Breakthrough time 480 minit. Lepas tu material test the material. Lepas tu splash contact material nitrate rubber sama je macam yang atas. Physical and chemical property dalam bentuk powder. Lepas tu yang lain untuk order tak ada data. pH pun tak ada. Melting point and freezing point 135 darjah Celsius. Lepas tu stability and reactivity. Reactivity no data. Chemical stability stable under recommended storage condition. Possibility of hazardous reaction no data. Condition to avoid exposure to moisture. Incompatible materials, strong oxidizing agent. Toxicological information of toxicology effect. Acute toxicity, inhalation, no data available. Germ cell mutagenicity, in vivo tissue mutagenic effect, hamster fibroblast sister chromatic exchange. Carcinogenicity, this product contain component that not classifiable as to the carcinogenicity based on IARC. Ecology information. To disposable consideration with treatment method. Offer surplus and non-recyclable solution to a licensed disposal company. To contaminated packaging, dispose of a unused product. Ini untuk regulatory information dia. SARA 313 component do not contain chemical component with known CAS number that exceed the threshold. Ini highlight for HYDROXYUREA untuk jabatan masih hospital Ipoh ni untuk aktiviti kerja mengisi ubat untuk dibekalkan kepada pesakit hazard dia, pendedahan terhadap ubat kemoterapi yang toksik, kesan dia, genetic effect, emerging fatality and unpunctured, kawalan sedia ada, kompetensi, safe work procedure. Lepas tu kebarangkaliannya L4, keterutan 1, risiko dia 4, risiko dia low. Cadangan kawalan, supervision and training, lepas tu pakai PPE. Untuk
Misbah, boleh buka poster? Poster boleh buka? Mr. Misbah boleh buka poster?
Okay, untuk poster saya buat untuk tuberculosis, questionnaire TB is airborne infection disease, spread from infectious to non-infected person through the air by droplet containing TB bacteria.
Sorry, Mr. Misbah, awak share tak dekat dengan kami the poster? Sebab saya
Share?
tak nampak poster awak. Share ke? Cuba tekan macam tadi balik, share.
Ada?
Tak ada, tapi tak apalah. Proceed je dulu, nanti kemudian kita boleh tengok. Tak apa. Proceed dulu presentation.
Okay, aktiviti kita receive trial ni, hazard dia exposure to known and unknown bacteria, fungal and virus, cause and effect dia, fatality, existing control dia, competency and wear proper PPE. Lepas tu probability dia 5, severity dia 4, jadi risk dia 20, high. Lepas tu testing blood sample, sama juga hazard dia, exposure to known and unknown bacteria, fungal and virus, effect dia sick and fatality. Lepas tu existing control, competency and wear proper PPE. Probability dia sama juga 5 dengan 5 dan severity dia 4. Jadi high ya. Lepas tu untuk risk control dia, supervision and training. Lepas tu pre-replacement examination. Okay. Ini untuk BSc saya, handling of hazardous agent microbiological. In BSc, lepas tu nombor 1 beginning with the PPE, personal satu
Cik Misbah tengah bentangkan slide mana Tas yang mana?
apa?
Okey.
Yang ni untuk TB, untuk poster.
Poster.
Yang tak di poster tadi. Sekarang ni untuk yang video yang demo, yang untuk tajuk nombor 1, aktiviti 1.
Video tu awak ambil direct daripada YouTube ke atau awak ada olahan?
Direct. Saya cut.
Kat buat sambungan ke atau macam mana?
Tak ada.
Tak ada buat penyambungan lah, maksudnya ambil je link daripada YouTube. Kalau ambil daripada YouTube, tak apalah, kita tak perlu proceed dengan video sebab copyright punya isu nanti. Mungkin boleh proceed ke seterusnya.
Untuk yang ni
Kami tak nampak apa-apa yang Tuan share ni sebenarnya. Okey, boleh. Silakan, teruskan. Masa ada tinggal lagi 2 minit Tuan.
untuk next activity, handling of hazardous agent, tajuk microbiological. First, beginning with the PPE. First, wear glove, thicker glove, provide better protection as a cytotoxic drug. Lepas tu, wear protective gown. Gown must made of low permeability fabric with a closed front, long sleeve and closed cuff. Lepas tu untuk eye protection, must wear like splash goggle. Should make available for use any situation where there is a risk of splash into eye. Lepas tu operation and procedure, start up. Load the cabinet with all items required prior to starting work and surface decontaminated. Lepas tu decon the surface with the side wall and inner back wall. Lepas tu allow the work zone air to push for a few minutes before commencing work. Lepas tu do not overcrowd the work zone. Lepas tu close the drain valve before operation. Next, time operation dia, do not obstruct the front or back air grill. Lepas tu work as far into the cabinet as possible. Lepas tu minimize arm movement, make slow movement to avoid disrupting cabinet airflow. When removing arm from cabinet, make sure to surface decontaminate first and move arm slowly out of the cabinet. To minimize external airflow disturbance, work from clean to dirty. For your connection, bag should be placed inside the cabinet instead of outside. Two manipulation activity, preparing BSc for work, confirm BSc annual within 12 months. Certification is current. Lepas tu cabinet blower at least 3 to 5 minutes before beginning work to allow the BSC to push particulate. Use alcohol to clean work surface of BSC and to sterilize any glass. Use amount of alcohol in BSC to working in the BSC. When working in cabinet, move arm in and out slowly, perpendicular to the face opening to reduce disruption of air curtain. Perform all operation at least 4 inches from the front grill on the work surface. For BSC cleanup, apply alcohol using white and spray bottle to minimize solvent vapor concentration being recirculate in the blood in the hood. 2. Cabinet sash to remain open to allow for alcohol evaporation. Sash can be lowered after sufficient time. The recommended minimum time for sash opening is 10 minutes. First, do not bring potentially contaminated material out of the cabinet until they have been surface decontaminated. Alternatively, contaminated material can be placed into closable container for transfer to an incubator, autoclave or another part of the lab.
Okey, tuan, sorry tuan. Tak apa, kita rasa masa agak mencemburui, kita kena tangguhkan dulu tuan. It's okay. So kita akan proceed pada discussion lah ataupun kepada ada poster tadi dah present
Present tak boleh share.
Tak boleh share. Okay, never mind. Mungkin ada soalan daripada panel dulu. Kita boleh raikan dulu sebab kita tak sempat dan takut ada tak sempat present lagi ni. Silakan. Mungkin daripada Puan Mazdila atau Puan Azlina nak tanya soalan.
Alright, saya take part first lah. Alright, Assalamualaikum Tuan Misbah.
Waalaikumsalam.
Sihat hari ni?
Sihat.
Boleh saya tahu Tuan Misbah daripada hospital ke klinik ke mana? Terima kasih.
Hospital.
Sihat hari ni? Hospital mana Puan?
Hospital Kemaman.
Kemaman.
Hospital Ipoh. Praktikal. Hospital Ipoh.
Hospital Ipoh. Tak, maksudnya sebelum ni bekerja di mana?
Hospital Kemaman.
Hospital Kemaman. So praktikal dekat Hospital Ipoh?
Betul.
Okay. Alhamdulillah. Alright, saya just nak sharing berkenaan dengan apa tu tadi? SDS tadi tu kan? Secara overallnya semasa bila ya pendedahan yang kepada bahan ataupun ejen yang Tuan pilih tu?
Ini semasa kerja.
Semasa kerja tu adakah waktu handle bersama operator saja ke ataupun melibatkan kepada patient?
Kepada patient.
Melibatkan kepada patient.
Buat time prepare buat time filling tu lah.
Secara overallnya apa yang bahaya yang Tuan nampak? Adakah dia sangat berbahaya ataupun tidak ataupun macam mana? Mungkin Tuan boleh explain sikit berdasarkan pembacaan dan pengalaman Tuan.
Macam kita time nak prepare ubat untuk dispense kepada patient, time kita filling ubat tu lah.
Okay. Right, itu saja soalan daripada saya. Mungkin panel yang lain akan continue to ada question. Right, thank you Tuan Misbah. Good luck. All the best.
Okay, terima kasih tuan. Saya persilakan Puan Azlina kalau ada nak tambah. Dipersilakan tuan. Persilakan Puan. Puan Azlina. Tak ada Alright. Kalau tak ada, tak apa. Saya ada dua saja soalan. Soalan yang pertama adalah mengenai biosafety cabinet. So biosafety cabinet yang tuan pernah ada pengalaman gunakan, ya biosafety cabinet jenis apa tuan? Laminar flow ke ataupun yang jenis kelas 2A ataupun 2B? Mungkin boleh share experience?
Laminar.
So yang kedua, saya just nak tanya soalan berkaitan dengan penilaian risiko yang tuan buat ni. Tuan buat pakai chemical apa tadi ya?
Apa?
Tuan buat pasal chemical risiko apa untuk CSDS ni tadi?
HYDROXYUREA.
HYDROXYUREA. Okey, dari segi pengkelasan hazard dia tuan nak bagi berapa? 1 sampai 5.
1, 3.
3. Atas alasan apa tuan bagi tahu 3 tu contoh?
4 sini.
4. 3, 4. Dia toxic lah basically kan. Dia boleh menyebabkan masalah kesihatan lah. Cuma dia tak mungkin serius lah kan. Okey. Itu saja soalan daripada saya. Saya mohon Encik Misbah untuk tunggu seketika di dalam studio sehingga kita tamat. Okey, kepada yang sedang dengar live ni, kita akan sambung sebentar lagi. Berikan kami sedikit masa. Sekian. Silakan.